Now, Democrats and the media are now freaking out over RFK Jr. and his major announcement: changes to vaccine policy, removing soda from SNAP, and cutting the workforce by 10,000 employees. Now, I'm going to show you why this is a smart decision on his behalf, but let's hear more details first.
RFK Jr. says over the last 4 years of the Biden administration, the HHS's budget has increased by 38%. Its staffing, meanwhile, has increased by 17%. But despite more money and more people, the Health and Human Services Agency, according to RFK Jr., has failed to improve the health of Americans. Right now, the U.S. currently ranks last among 40 developed nations in terms of health, with the highest rates of chronic disease. This despite spending 2 to 3 times more per capita than other countries. Meanwhile, Americans' lifespans, they are now 6 years shorter than that of Europeans.
But they want you to believe that RFK Jr. is going to hurt our children. He's going to hurt you. He's going to make this country slip into more pandemics. I mean, this is the type of scare tactics that the media likes to push. But what we're going to do is focus on what the numbers say. And Callie Means actually put up a post that is profound to me. Just look at this, okay? Growth in physicians and administrators. Look at that. So from the year of 1970 all the way up to, 2009, look at how many administrators increase in the HHS, but the physicians kind of basically have stayed the same. I mean, it's laughable, right? So they have more employees, more administrator, more people wearing suits all day making decisions about our health, but we don't have more doctors. Now, you help me make sense of that. Now, here's RFK Jr.'s reasoning about why he's doing this.
HHS is a sprawling bureaucracy that encompasses literally hundreds of departments, committees, and other offices. When I arrived, I found that over half of our employees don't even come to work. HHS has more than 100 communications offices and more than 40 IT departments and dozens of procurement offices and 9 HR departments. In many cases, they don't even talk to each other. As part of President Trump's DOGE workforce reduction initiative, we're going to streamline HHS to make our agency more efficient and more effective.
As part of HHS's downsizing, the FDA will cut about 3,500 jobs. The CDC will cut about 2,400 jobs. Kennedy says HHS's workforce will downsize from roughly 82,000 employees to about 62,000, saving the department about $1.8 billion, merging old agencies within HHS into a new organization called the Administration for a Healthy America, or AHA.
Now, this is exactly what anybody would do if they're really trying to optimize business operations, right? Make things efficient. They would look at what doesn't work, get rid of it, and double down on what works, right? And then bring their own ideas. And that's exactly what RFK Jr. is doing, because it's all behind the mission here to make America healthy again. And here's the other thing. It's easy to agree that there is a problem, but it's almost impossible with these politicians to agree on the solution. I'm going to show you why. Here is the governor of Hawaii using scare tactics when he responds to what RFK Jr. has decided to do.
RFK is cutting a quarter of the workforce at HHS. It's going to happen in a matter of days. 25% of them gone, every single unit affected. So you're the governor of a state. You've got to deal with worries about possible pandemics, other major public health crises. What does that mean? Are you even able to tell what that means if HHS loses 25% of its workforce in the next days?
Yeah, it's a disaster. It's public health malpractice on the part of RFK Jr. and the DOGE team. It's going to cause loss of life in our state and in Kansas and in Texas and wherever else disease spreads. It's outrageous. And these guys don't know anything about healthcare. Nothing. RFK Jr. knows nothing about public healthcare. He's got no training. He's got no experience. And it was bad enough that he cast doubt and spread misinformation about vaccinations, but now he's taking away the tools from we governors and directors of health and other health professionals. He's taking away those tools for us to keep our people safe. And I don't know why anyone would let him do this.
Okay, so let me just get this straight. The corporate media, big pharma, and obviously career bureaucrats want you to believe that trimming the fat from one of the most bloated agencies in Washington is somehow a threat to public health. But let's actually ask the real question. What has HHS actually done to improve our health, Just look at the numbers. Because the last time I checked, this agency has oversaw skyrocketing obesity, record levels of chronic disease, a disastrous COVID response, and billions of dollars wasted on programs that have produced zero results. So is it really about the health of Americans, or is it about control, power, and money? I'm sure you know the answers to that.
We cannot have a strong country if we have sick citizens. President Trump says that he wants to restore the American dream. But a person who is healthy has 1,000 dreams. A person who is sick has only one. And there is 60% of our country now that has only one dream, which is to get better. And we need to give them a pathway to doing that. And the pathway is through food. Food is medicine.
Exactly. Food is medicine. So why doesn't the federal government, particularly HHS, enforce more regulation to make sure our food is healthy? It's because there's a competing business. It's called Big Pharma. They make money off people being sick. Everybody knows this. But the real question is, what are we prepared to do to change it? And I'm actually optimistic for the very first time that just maybe, finally, someone like an RFK Jr. and particularly President Trump will actually do at least one thing that will make this country healthier. And after that event where they announced that they would be looking to remove soda from SNAP, he put up this post. He wanted to thank the West Virginia governor and legislators for leading the nation in passing a bill to clean up our food supply and submit a waiver to remove soda from SNAP. I commend the 24 states pushing MAHA bills to clean up our food system, improve school lunches, submit waivers to SNAP, and promote patient choice. This state leadership adds leverage to the Trump administration drive to make America healthy again. I urge every governor to follow West Virginia's lead and submit a waiver to USDA to remove soda from SNAP. Now, listen, I don't think you need a presentation on why that should happen. Why is the federal government subsidizing food and drinks that we know are not healthy? Does that mean a child should not be allowed to drink soda? No. It just means the federal government and your tax dollars should be paying for it. Now, if you need more receipts on why RFK Jr. should cut 10,000 employees from HHS and consolidate a lot of these agencies, here he is explaining his thinking with the receipts.
Elon did with our agency is going to help our agency. So I'm very grateful to him he came in for the first time with a real org chart for the agency. The agency org chart, when I arrived, was incomprehensible. There was no chain of command. There were people operating in all these different silos and fiefdoms, and they were so territorial and so self-serving that they were selling patient information to each other. So I tried to get the CMS patient information, which belongs to the American people and belongs to HHS. And the sub-agencies said we have to buy it from them. And it doesn't make any sense. There are sub-agencies that refuse to give us patient data. This is depersonalized data. Mm-hmm. And we need to make America healthy again.
Now imagine that. Sub-agencies are selling patient data to each other. How does that even financially make sense as far as the budget is concerned? That's the interesting part. And what's even more interesting when you really look into this, the Department of Health and Human Services is the most bloated agency, spending the most money in our federal budget. I used to think it was the Department of Defense, but it's actually Department of Health and Human Services. They make up 30% here of our budget. So I actually think it's a good idea that Elon Musk should be going into HHS, finding things that don't work, removing them, right, and making things more efficient and get the corruption out of there. I mean, it's very clear that studies are paid for by Big Pharma, right? Policies are pushed by Big Pharma because they make more money off of it. Everybody knows this. It's human behavior, okay? But Democrats don't want you to believe that. They want you to believe that what RFK Jr. is doing here is a threat to public health. Take a look.
Another good example is what's going to happen with HHS. A huge number of employees are going to be let go there, and that's going to affect everything from the FDA's ability to control the youth vaping epidemic to what's happening with toxic heavy metals in baby foods. Right now, very little. And if you shift resources further away from the FDA, they're not going to have the ability to do anything on that.
All right, let's do a little fact checking here. First claim was what? Firing HHS staff would hurt the FDA's ability to address youth vaping. The reality is this: the FDA has already failed to curb youth vaping despite ballooning budgets and staff increases. How do they explain that? The second thing is toxic heavy metals in baby food requires more FDA oversight. The reality is the problem existed with full staffing. See, they think more people and more money is the solution. It's actually the process would be the solution, and getting wasteful and bureaucratic things out of the way so they can get results. Now, here's RFK Jr. making an announcement about the policies surrounding vaccines. Take a look.
Will anything change about vaccine policy?
Yeah, everything's going to change because we're going to have good information. And, none of the vaccines that are given, but people said to me during the hearing, this link between autism and vaccines has been disproven. None of the vaccines that are given during the first 6 months of life have ever been tested for. The only one was the DTP vaccine, and that one study that was done, according to the Institute of Medicine, the National Academy of Sciences, found that there was a link. They threw out that study because it was based upon CDC's surveillance system, VAERS, and they said that system is no good. I think it begs the question is, why doesn't CDC have a functional surveillance system? We're going to make sure they do have a functional surveillance system. Right now, the surveillance system is the system that, because they don't do pre-licensing safety testing for vaccines, they're the only product that's exempt. So what they say is, if there are injuries, we'll capture them afterward. But they have a system that doesn't capture them. In fact, CDC's own study of its own system said it captures fewer than 1% of vaccine injuries.
Now, why does this matter, right? Because if you have children or grandchildren, this should absolutely concern you. The fact of the matter is, we cannot even track the injuries that are occurring from people who are getting vaccines. Not because we want to get rid of vaccines, but we should be doing that because we want to make vaccines better. But let's remind ourselves of one thing. Even if we tracked the injuries, currently right now, you can't even sue those companies. So what true accountability do these vaccine companies have, especially when you find that people in Congress either have stocks invested into these companies, by the way? They clearly are part of lobbyists. And not only that, what is the number one advertiser for the mainstream media? It's Big Pharma. So what incentive do they have to truly do the right thing? They don't. And that's why you're not going to see any Democrats come out and support what RFK Jr. is doing here. They may agree on the problem, but they're definitely not going to agree on the solution. And in fact, they're just going to fight him every step of the way here. And who's going to help them do that? The mainstream media.
Anything from Capitol Hill, Democrats in particular, about what these cuts may mean?
We're hearing particularly from Democrats in the Senate Health Committee. Edward Markey putting out a statement today saying, quote, this evisceration of workers isn't just a restructuring. He says it's a catastrophe in the making that'll disrupt services, violate federal law, and deny the livelihoods of workers who dedicate themselves every day to protecting public health, all to pay to take breaks for billionaires while American families pay the price of illness and death. He says we will not let this stand. And Phil, we heard a similar message from Bernie Sanders, also on the Health Committee, who pledged to fight these cuts. So we'll have to see what Democrats in Congress can really do about this.
Okay, because of the layoff of these 10,000 employees, we know the media and Democrats will continue to spin this, but I'm going to continue to show you guys what the numbers say. In 2024, the HHS spent $1.7 trillion of the total federal spending, making it the top spender. We've already talked about it earlier. But since 1980, overall, federal spending has risen 193.7%, while Department of Health and Human Services spending has increased 547%. Where's all that money going is the true question here. In 2024, the biggest spenders within HHS were Center for Medicare and Medicaid Services, Administration for Children and Families, and the National Institutes of Health. So the question is not necessarily, why are we spending so much money? I think the better question is, what are we getting in return for spending that amount of money? Big picture here is Democrats will cry and scream. They will, in conjunction with the media, push scare tactics as their talking points. And it arrives at probably the most important question, if you are on the left. Is this actually legal? what he's doing?
Do you anticipate, because we saw this with the Doge cuts, which seemed slapdash in nature, do you anticipate that we are going to see the same kind of backtracking here of, oh, we didn't realize we were cutting people who dealt with bird flu or something else that's active and important within the CDC or the National Institute of Health? Do you expect that, or are these more targeted and slightly more thought through?
They say that they're more thought through. They say that they've looked and, they have a lot of duplicity. They say that they can bring things in and streamline. There doesn't appear from experts we talk to that they're violating any laws or anything like that would allow them to be stopped in court. So it appears this will go through, but it could be that kind of thing where down the line, people are wondering why services are slower or this, that, and the other.
Yeah, so number one, clearly it's painful for them to admit the truth, which is RFK Jr. is not breaking any laws by reorganizing the agency that he's in charge of. But secondly, whatever services she claims is becoming slower, it's been slow. It's been broken. Okay, it's inefficient. We've showed you that throughout this entire video. I mean, for Christ's sakes, they're making money on selling patient data to each other. Who does that exactly? So it brings me to the question of this video. Do you support what RFK Jr. is doing by laying off 10,000 employees, consolidating agencies, getting rid of soda in SNAP, not banning soda, but not allowing the federal government to subsidize that anymore, and also re-looking at the policies around vaccine injuries? Let me know your thoughts about this entire story in the comment section below. Now, earlier this morning, we posted a video about Hakeem Jeffries and how he has lost control of the Democratic Party. He's struggling. You got Jasmine Crockett saying things he would rather not hear. You got people calling for Chuck Schumer to be primaried. And you have the Republicans continuing to unify and push the America First agenda forward. So if you want to see him melt down once again, all you have to do is click on that video because it's coming up right now.